The earliest win starts at zero. Apollo Cancer Center launches campaign Zero to Hero for World Cancer Day *. Bengaluru, 4th February 2026. Apollo Cancer Center has launched its Zero to Hero campaign in observance of World Cancer Day on 4th February 2026, driving a transformative movement toward detecting cancer at stage 0 and enabling better survival and recovery. Cancer cases in India are rising sharply, with over 15 lakh new diagnoses reported in 2024, and numbers continue to increase each year, according to ICMR-NCRP data presented in Parliament. With 1 in 9 Indians now at lifetime risk, cancer has emerged as a pressing public health concern. Yet, over 70% of cases are identified only at late stages, 3-4, when treatment is tougher, outcomes are poorer, and the financial strain on families is significantly higher. In response to these alarming trends, ACC's Zero to Hero campaign spotlights the life-changing impact of stage 0 detection and early intervention, turning a diagnosis into a story of survival.
Last year we emphasized on unify to notify for the simple factor that in the whole of India, there is not a single law passed that every state needs to notify cancer. What has happened after that, the campaign which many members of the media supported, is it's been taken up in multiple forums and committees and has got a bill passed in the Rajya Sabha that the whole of India should have cancer as a notifiable disease. Today, as we discuss on this forum, almost more than, I think, 13 states have got cancer as a notifiable disease, which a few years back was none. And that will fold into every state and union territory notifying cancer. So one of the things which does not get picked up, and it's important when we're talking screening and diagnosis, which at Apollo we've been talking for the last 2 years, whether it's FAM for breast, or cold fit for colon, or for lung, it's called lung life, or for gynecological cancer, check, we're consistently talking this. It's easier for the clinical teams and for the patient and the caregivers to win over cancer if you get diagnosed early. And there's a stage called stage 0, where actually you have between a 95 to 100% chances of winning over cancer. And we're trying to emphasize through the forum today and members of the media why even a city or a state, because that gives out a true picture. Are people getting diagnosed early or not? Otherwise, today, we do not even know how many people are getting diagnosed. At Apollo, we took up this initiative for 3 years back, understanding the importance of stage 0 cancer. And in the last 3 years, we have over 1,595 patients who have actually come forward for screening and have got diagnosed at stage 0. During the course of the interaction today, the clinicians will talk more about the importance of stage 0 cancer and why is it important to understand it. And through the voices of the patients, you get to understand more about from a 0 to hero, how do you become, especially when it comes to cancer. And the first stage for you to take the battle on is actually screen, prevent, and actually see if you can be somebody who gets diagnosed at stage 0. Thank you.
And I would like to place on record the efforts done by the Apollo Hospital's high leadership team for consistently putting in these efforts in this direction. And every year we have some event to showcase showcase our efforts towards cancer control. Mr. Dinesh, Mr. Akshay, and all of you, thank you so much for that. And this year's campaign is also a wonderful thing, Zero to Hero, where we are trying to catch cancer early. And so, like Mr. Tejas said, these patients end up having a 95 to 100% chance of cure. So we do know that cancer in India is, the overall burden of cancer is around 15 lakhs per year. And several patients are actually diagnosed in the stage 3, stage 4 cancers. Though the treatment paradigm has significantly changed in stage 3 and stage 4, but these patients require complex treatment like surgery, radiation, mutilating surgeries, radiation, chemotherapy, and then targeted therapy and immunotherapy. And of course, it's a major emotional turmoil as well as a financial toxicity, which is significant for these patients. So that is where the concept of early diagnosis is important. Like Dinesh said, stage 0 screening, which my other colleagues are also going to allude to. There are several cancers which can be screened like the colorectal cancer, the prostate cancer, cervical cancer, breast cancer, and now in high-risk individuals who are smokers, even lung cancer can be screened. So catching these cancers early is very, very vital. So what can we achieve? Number one, these patients can have a very less mutilating surgery, simple surgeries, which Dr. Jayanti also will speak about. Simple removal of the lump, like lumpectomy for breast or even for cervical cancers, it will be a far lesser mutilating surgery. And then they may not require additional modalities of treatment like radiation or chemotherapy. So there's lesser toxicity, better cure rates, and not only that, over a period of time, these patients will be survivors, and there's a 95 to 100% chance of cure. And survivorship is also an important aspect. And if
healthcare not got to go to them and try to visit them still. Thanks.
We can prevent them from getting cancer in the future. Thank you.
Ulcer, anything which they feel is abnormal has to undergo a testing. Now, screening in head and neck is very simple. It's not as complicated in other places. Each and every one of us can open our mouth, look inside the mouth. Takes about 30 seconds, and we will be able to catch things.
Hello everybody, I'm Dr. Jayanti Tumsi here, working as a lead and robotic surgeon in the Department of Breast Oncology at Apollo Cancer Center in Bangalore. Today is February 4th, which is celebrated as World Cancer Day. We know that the incidence of cancer is on rise all over the world and also in India, and hence becoming aware of it, spreading awareness of this disease is very, very important. Cancer is no more a disease which should be feared as in the past, because there are many cancers where early detection is possible. And early detection is the game changer as far as cancer treatment is concerned. And today's campaign through Apollo Hospital is from zero to hero. That means we are emphasizing on detecting cancer at stage 0. There are different stages of cancer, stage 0, 1, 2, 3, and 4. And today we promote detecting the disease at stage 0. What is stage 0 is that cancer is confined only to that particular organ. It has not spread anywhere. I'm talking about breast. There are breast ducts, the milk ducts. The cancer often starts in the milk ducts. And if it is confined only to the duct and not spread anywhere, that becomes stage 0, which we call as ductal carcinoma in situ, which is a pre-malignant condition. Now, if we don't treat it, there are very high chances that it can progress into cancer, and from stage 1, it can become 2, 3, and 4. If we detect the disease in stage 0, usually surgery is what is indicated, and surgery is often very simple, and such a patient may not even require any chemotherapy, radiation therapy, or any further therapies, and hence we avoid the side effects which are associated with these therapies. The duration of the treatment becomes lesser, and also the cost comes down, and the cure rate is almost certain if we detect the disease in stage 0. So for women, I would recommend that do breast self-examination once in a month, starting from age 20, and do a mammogram test from the age of 40 once in a year. And that way we can detect breast cancer at a very early stage. Thank you very much.
Thank you.